So today we will talk about ESTIM and how it's used for soft tissue healing. Um, Here we go. So first we're going to look at our outline. This is what we'll be covering today. The mechanisms underlying electrical current for tissue healing. So first is galvanotaxis, which I'll go over on the next slide, which attracts appropriate cell types to help with healing. Activate cells by altering the cell membrane function, enhance antimicrobial activity, enhance circulation. It can also decrease inflammation. And one more I wanted to say, increase oxygenation. So all of those together help with increasing wound healing. Galvanotaxis, so that's the movement of cells in response to an electrical field. Hold on. I sneeze like half of these. Right, sorry about that. Okay, so when the cell membranes are damaged, that's because of injury, they allow ions such as sodium and potassium to leak out of the cell. This causes the injured area to carry an electrical charge that is different than the surrounding tissues. This activates the healing process. It attracts cells such as like neutrophils, macrophages, lymphocytes, fibroblasts, those types of cells that have a charge. It attracts cells that cause healing to activate the healing process. This is known as the skin battery. So ESTIM with a monophasic pulsed or a direct current replicates the same effects of the skin battery. So it attracts certain products to the area, repels other products from the area in order to promote healing. Negative electrodes are typically placed over a healing area to promote healing of an inflamed or infected wound in order to attract some of the positive particles that they want to gather to the area and push some of the negative away. And then if the patient has a chronic wound or wound that's having issues with healing or is not any longer in like the inflammatory phase, but they want to increase some of those healing products to the area, then you would place the positive electrode over the wound. For chronic wounds, the Center for Medicare and Medicaid approves payment for ESTIM for stages 3 and 4 chronic wounds that have not responded to standard treatment in 30 days. So not everybody is going to get covered for wound healing electrical stimulation, but in this instance, they would. Some of the studies support that ESTIM facilitates wound healing by improving the rate and reduction of ulcer size, increases the likelihood of complete wound closure, and saves healthcare costs. That's what some of the studies are showing. With edema control, if the edema is due to inflammation, so if they're kind of in those beginning stages of healing, if the area is hot, it's red, it's swollen, then you want to place that negative polarity. HVPC is high, I know I'd forget, volt pulsed current, high volt pulsed current. You want to place the negative polarity, high volt pulse current over the area that's swollen in order to slow the formation of acute edema, in order to push some of the swelling out of the area. The negative charge repels the negatively charged serum proteins, and typically you could decrease the edema in the area up to 50%, which is a similar magnitude to if you submerged that area into cold water, or if the patient used ibuprofen as a means of edema control. And anytime you use this, you do need to use compression afterwards, to use some type of compression to keep the swelling from returning. If the swelling is not due to inflammation, but due to a lack of muscle control, like they don't have the muscle pump that's pushing the venous return or the blood flow back to the heart, and so it's allowing to settle and pool in that area, then you can use more of that motor ESTIM like Russian or something like that in order to create a motor response and pump the muscle in order to push the fluid back. So if the area is cold, pale, and swollen, then that's more of an indication that it's no longer acute inflammation. It's more of inflammation related to the lack of muscle pump versus to a healing response. And so you want to contract that muscle in order to promote healing. So you want to put the electrodes over the muscle that is closest to the largest veins in that area to pump them out. And always, both of these pictures, if you notice, have the limb propped up. Elevation, you want them to be elevated above the level of the heart. So even if the leg's propped up, but they're sitting up, it's probably not above the heart. They'll probably need to be laying down with the leg propped up in order to push that fluid back to the heart. And with each type of edema, ESTIM afterwards, you would like to have some level of compression in the area to keep the edema from returning. Iontophoresis, so this uses low amplitude direct current to facilitate transdermal drug delivery. So there's typically one electrode where there is some type of medication on it, and another that is like more of a non-active like control that doesn't have the medicine on it. Okay, so how it works is based on the principle that like charges repel each other. So it's typically most commonly used with dexamethasone, which is an anti-inflammatory corticosteroid. It has a negative charge, so you would place the negative electrode over the patch that has the dexamethasone on it, and then the positive over the other patch. Though it allows the drug to be pushed in, but beware that it only goes in a few millimeters before it's carried throughout the body and into the circulation. So there is some of the drug that is carried into circulation, goes to other parts of the body, but it is a more direct way of delivering the drug to that area. Of course, you could do a shot, which delivers it to the area, but it also enters the bloodstream as well. There are different medications that have different charges, and that will determine if you need to put the negative electrode over that medication or the positive. And so any of the medications that have a negative polarity, you would want to put the negative electrode over it because you're trying to repel the medication to push it into the skin. If you put the wrong charge, then it would just suck. I mean, it would just keep it where it's at, but it essentially could suck it towards itself. So you would want to be aware of what medication you're using and what polarity it has to put the right electrode over that medication. Contraindications, let's see, I have that there. Okay. Contraindications and precautions include all of the standard contraindication and precautions for ESTIM. And then iontophoresis should not be used after heat, ice, or ultrasound. So you could use it potentially before. Remember, ultrasound actually helps deliver the medication even deeper. So you could potentially use it before, but not after an ultrasound or heat or ice. And then you also need to be aware of the contraindications for the drug that you're using. And follow those as well. So being aware of those is important. The application techniques. So for wound healing, the waveform is typically a monophasic pulsed using that high volt pulsed current. The polarity in the early stages of inflammation, we are using a negative charge over top of the swollen area, and the positive goes elsewhere, versus if we are later in more of a chronic wound that's having trouble healing and we're trying to help with epithelialization and healing of that wound, then we could put the positive electrode over the area that we're trying to promote healing and the negative elsewhere. The pulse duration is typically between 40 and 100 microseconds, and most machines come with that preset and you can't really change that. The frequency is somewhere between 60 and 125 pulses per second. The amplitude, it needs to be comfortable for the patient, but they can feel a tingling sensation. Sometimes it's like an uncomfortable tingle, so I always say strong but not uncomfortable. If it gets uncomfortable, let me know and I'll turn it down. That's kind of my spiel. Treatment time is typically between 45 and 60 minutes. For wound healing specifically, there's two different ways that you can apply the electrodes. You could place one electrode in the wound. You need to have the electrode moist and so that it adheres to the area. And then the other larger electrode would be placed several inches away from the wound, or you could surround and have an electrode around the wound and a larger electrode um, also around the wound. So rather than inside, just surrounding. The larger electrode is used to disperse the current more evenly, so it's more comfortable for the patient and less likely to cause any adverse effects, and so that you can still use a higher current that you need without it being uncomfortable or painful to the patient. Some of the parameters for controlling edema. So if you're doing the edema control due to inflammation, remember the negative electrode is over the area of swelling and the dispersive electrode is over a larger flat area. The pulse duration is 40 to 100 microseconds. Negative is over the area of edema. The frequency is 100 to 120 pulses per second and needs to be comfortable for the patient, but they can feel some tingles and that's fine. And the treatment time is typically 20 to 30 minutes with the area elevated if possible. The parameters for controlling edema due to lack of muscle contraction, remember the positive electrode is over the area of swelling, and typically we're using either pulse biphasic or Russian protocol, ideally over a main vein to help drain the area. The pulse duration will be more like 150 to 350 microseconds. The frequency is 35 to 50 pulses per second. The on-off time here can be 1 to 2 seconds on, 1 to 2 seconds off, so more of that 1 to 1 or 1 to 2 ratio versus Russian stim that we use to to strengthen a quad. We want at least 30 to 50 seconds off time for every 10 seconds that you're on. So rather than that 1 to 1 ratio, it's that 1 to 3 or 1 to 5 ratio. So much less off time needed for this type of ESTIM. The amplitude, it needs to produce a small visible muscle contraction. So we're not going to the full contraction, just a small visible contraction of the muscle. And the treatment time is also 20 to 30 minutes. For Ionto, we typically use 40 milliamps per minute. And what you can do is you can slowly turn, there's a little knob on top of most of the machines that you slowly turn up to the patient's comfort. And it does feel like prickling. It can get uncomfortable. The higher you turn that up, the closer to 4 milliamps, the less time it takes to deliver that medication. So if they're not able to tolerate much, that's fine. You can keep it low, but it's going to take longer for the medication to be delivered. If they're able to tolerate a higher amplitude, then you can turn it up and it will take less time to deliver the medication. There are some units, like in this picture here, that you can actually put the medication on and put on the patient, and then they can wear home. And so it could take 80 minutes or so to deliver that amount of medication. It's a lot more comfortable for the patient. Typically, those type of electrodes are disposable, so they get home and they just throw them away. They don't have to worry about returning them. And it uses a much lower current. It could be even used up to several hours to deliver the medication if needed. All right, when we are documenting our ESTIM for tissue healing, we want to document the patient position, the electrode type, and the placement, the waveform, the pulse duration, frequency, on-off time. So all the parameters including duration or treatment time, and then the patient's response. Some of the same parameters that we've been documenting all along for all of our ESTIM. All right, so if you do have questions, please reach out, and if not, I will see you in the next lecture.